Well, good morning. It's great to be here in Columbia County. Madison, please. We're Bring Your Kid to Work Day. We're doing this. We got another great retail pharmacy announcement in Jacksonville, which we're excited about. And then we're going to the TPC. That's our old neighborhood, and Madison's our only kid that really remembers us living there. So we're looking forward to doing that. Before I talk about what's happening today, which we're really excited about, I just want to point out, U.S. News and World Report, they do a lot of rankings about education, and we're still #1 ranked for our state university system. We've been #1 now for the last 5 or 6 years, so we're really proud of that. But we're also improving in the K-12. So when I became governor, we were 40th under those rankings. Now we're 16th. So our overall education rank under U.S. News from pre-K all the way through the universities is #3 in the country. And so we really appreciate it. We really appreciate a lot of work that the folks here in Columbia County and throughout the state of Florida did to make sure our kids could be in school for this school year. And so I think the future is very good. I think we're going to do even better going forward, and we're going to continue working really hard on doing that. So today's a great announcement. I do want to thank Tom Mofsis, the health officer for Florida Department of Health. When the Johnson & Johnson vaccine was approved, I was really excited about it. Some of the media was saying, oh, it's not as effective. And if you looked at the clinical data, it was 100% effective at preventing death and serious hospitalization. So you may have a little bit more chance to get a mild infection, but I mean, come on, this is a really good thing. 1 dose and you're done. So we thought it was going to be something was good, but we didn't know what the response was going to be or the demand. Turns out there's a lot of demand among seniors for the Johnson & Johnson. So today we're happy to be able to surge 1,000 Johnson & Johnson doses here in Lake City. And basically this is part of our effort to surge vaccines to areas that are performing a little bit below the state average in terms of senior coverage. So if you look statewide, we have over the vast majority, I think 55 of our counties are 50% or higher seniors have gotten shots. And the ones that are under 50%, we only have 1 county that has more than 100,000 people. That's Hernando. We're going to get them above it. We've been putting a lot of work in there. The rest tend to be more rural counties. And the good thing about that is if you surge vaccine at the right time and you have good folks working that gets the shots in arms, you can move those numbers up very quickly. So for example, I was in Highlands County last week. They were close to the bottom in senior coverage rates in the state of Florida. We did a vaccine surge. They actually had a good site at one of the malls there. So we did a vaccine surge. So just in a matter of less than a week, they're now 52% of their seniors. They were like 38% just a week ago. So now they're at 52% of their seniors, and I bet you they're going to be over 60% by this time next week without any problem. So I think that this is going to work very well here, and I think that just talking to some folks, there is demand for the Johnson & Johnson amongst seniors, really amongst everybody, and I think it's good. Now this is a permanent site that we're surging to. When we set up new sites that are temporary, the good thing about J&J is you could go do thousands of people and you don't have to worry about going back in 21 or 28 days. So from a logistical perspective, it's really, really good. So we're going to continue to do it. We've done about 60% of seniors. We've got a massive population. We've got about 60% that have had a shot here in the state of Florida. So we did do seniors first for a reason, and I think that strategy has paid off. I would like to just commend some of the areas in North Florida who've done a particularly good job. St. Johns County, 79% of seniors have gotten a shot. Wakulla, 76%. Nassau, 74%. Leon, 74%. Santa Rosa, 69%. Alachua, 69%. Gadsden, 66%. Franklin, 67%. Okaloosa, 66%. I mean, these are really, really good numbers. And we're not going to have 100% interest in it. There's some that don't want the vaccine, and that's totally fine. There's not going to be any mandates on vaccine. But to have those kind of numbers, and I think North Florida has really done a good job. We've also done well in South Florida. I mean, Palm Beach is 70% of their seniors. They got hundreds of thousands of seniors. Broward is almost 2/3 down in Broward. So we've done good across the state, but I think North Florida in particular, Clay is hitting 60%. Most likely we'll hit that today. So those are really, really good things. We're getting close to 3 million seniors reported as having received shots. The way this works is the reports lag by 4 or 5 days. I mean, you go back and look last 4 days of the week, we were doing 100,000 shots a day for initial doses. But if you had looked at it last week, it wouldn't have appeared that way yet because they add it. So I think we're probably at 3 million seniors either today or tomorrow, regardless of the reporting. And we are starting to see the demand soften with the seniors, which is a good thing because we're going to lower the age to 60 on Monday. So everyone 60 to 64, you can go. These sites here, like we have in Lake City, are retail pharmacies, health departments, anything that's there, you have access to. And I think we're going to get some pretty good demand there. But we're also monitoring the supply. We have some encouraging signals about the supply, both in terms of what the state is getting allocated, but also through the federal pharmacy program. So rest assured, if you're in that 55 to 59 age bracket, we want to lower that very soon as well. We may be able to do that quicker than initially anticipated. So we're working on that, and as soon as we have an announcement, we'll be sure to let everyone know. But I think that folks can anticipate, and we'll have an announcement today in Jacksonville about the retail pharmacy footprint. We're expanding that with Walgreens. We're going to do even more expansions with some of the pharmacies next week. And so it's been a very efficient way, an effective way to be able to get this done. We now have 157 CVS pharmacies throughout the state of Florida. That's across 30 different counties that are offering COVID vaccines. We have 730 Publix pharmacies in the state. We have 12 Walgreens. I'm going to announce an expansion of Walgreens today, which will be exciting. So it'll be way more than 12. 119 Walmart and Sam's Clubs, and 43 Winn-Dixies. So that's a pretty robust retail pharmacy footprint, and it is going to grow over the next week, which we really are excited about. Here in Columbia County, we have 1 Publix pharmacy and 1 Walmart that are offering the vaccine. So to schedule an appointment for Publix, visit publix.com/COVID vaccine. To schedule a vaccine at Walmart, visit walmart.com/COVID vaccine. Publix next window is, I believe, Friday morning at 7 a.m. You know, the good thing about some of these appointments, it used to be as soon as these windows open, you'd have like 10 minutes and thousands of appointments would just be gone. And now the window's open. And so you have a much better chance of getting that appointment now just because we vaccinated so many seniors that the demand has really softened, which we really appreciate it. So we're going to continue working hard on this. We haven't gotten any additional J&J for this week. We don't know that we're going to get any for next week either, but probably the week after that we'll start to do it. I think the production on that is going to ramp up very quickly. So we could be in a situation, go down to 60 on Monday, we get to 55 relatively soon, and then if the supply floodgates really open, we could be in a position sometime in April where it's just available and people can get it. And so that's really exciting because if you go back to the beginning of January for when we were getting 230,000 doses a week for a state of 22 million people with 4.5 million seniors, that's a much different situation than where we were just a few weeks ago. So I'm excited about what's happening here. I want to commend the folks here in Columbia County for reaching out to these seniors, offering the J&J, and the demand has been great. And so if we can go through 1,000 of these, I know they have the site today, I know they'll be back on Tuesday, that's going to make a really big difference. And you know what? The more people you do with the J&J, you don't have to worry about scheduling that second appointment. You don't have to worry about doing a lot of the stuff with the Pfizer and the Moderna that just make it a little bit more logistically challenging. So we're excited about that. Okay, who do we got? Yes, ma'am. Yes. They should be. I mean, we want everyone to report. I mean, we think it's you want the immediate reporting. It helps us identify where the needs would be. Now, that's obviously run by the feds. It's not run by the state, but it's important because what we do is we look every morning at the coverage rates for seniors because we're doing seniors first, And if they're not reporting it accurately, it could cause us to send vaccine in an area that actually is doing well. And there's other places where they're much better at reporting. So yeah, we'd ask them to report it. Usually you have 72 hours. I mean, our emergency order says do it within 24 hours. I think we're seeing that there is a delay in reporting, because if you look at today's numbers in terms of the number of vaccines that have happened, say yesterday, pull it out here. So yesterday it says 34,922 initial doses were administered. I can tell you tomorrow that number will grow. Yesterday, or excuse me, March 9th, they're now reporting almost 87,000. Yesterday that was like 44,000. So there's somewhat of a lag, but I think it's important to try to get it in real time as quickly as you can. It helps with everything. I mean, the more it gets in quicker, the easier we'll be able to get it to 60 and 55 and expand it to all the folks who want it. I think we've got a lot of great momentum. I mean, I think these retail pharmacies have been really, really good. And so when we brought CVS into Miami-Dade in a big way, we started to see those numbers really, really go up. We've also done some things that hasn't really been as publicized. We've given it to health plans, who then reach out to their own members and say, hey, I have this. So I think Blue Cross and some of those are now in the game. That's really, really good. We want to get more into physician practices and doctors' offices, because that's an easy thing to do. Because someone may go to the doctor for some other reason. The doctor say, why don't you do a COVID shot? And then you can do it. There's a lot of people that really want the shot. There's a lot of people that are indifferent about it. They're not opposed to it, but if you have it where it's convenient, they'll be able to do it. So I think we're continuing to expand it in a wide variety of ways. And I think by and large, it's working well. I mean, you don't get millions of seniors vaccinated by chance.
Governor, yesterday's CEO, how is that first principle conservative?
Excuse me?
Yesterday's executive order, how is that first principle conservative in your mind?
I'm not sure what you're talking about.
Banning the levying of fines?
But what does that have to do with first principle conservative?
How is it conservative and top down with that sword taking away that power from municipalities and localities?
Yeah, well, I don't think it's conservative or liberal. I just think that those fines are out of control, and we want to make sure that folks are protected. Most of those restrictions have not been effective. That's just the reality. The evidence is in on that, and so we want to really go forward fresh, and we want people to make decisions, but we don't want it under the heavy hand of government.
Governor DeSantis, we're seeing some states such as like Georgia and Alaska are dropping down their restrictions down to 16. Is that something that we're considering here, or do you have any estimate of when we'd be able to
For vaccine eligibility? So one of them, I don't know what J&J is. I know one of Pfizer and Moderna is 18 and 16, one of each. What I would say is that we're going on an evidence-based way. We're doing it based on where the greatest risk of mortality is. And so 18 and 19-year-olds are at very, very low risk. And in fact, if you look from 18 below, and I know people below 16 aren't eligible under the EUA, but we actually have less respiratory hospital admissions for 18 and under this year than we did pre-COVID in a normal influenza year. And so the risk is so radically different for elderly people that I think we're going to continue to focus on the 65. Look, we're almost home. We've done so many. We got to do some more. I know not everyone wants it, but boy, if we could get every county to be over 60, 65%, that's going to be really, really good. I think it'll save a lot of people. Then we do the 60. There's about 1.9 million people in Florida between 60 and 65. And then there's about same number. So every time you go down 5 years, you're adding between 1.5 to 1.9 million. And I think that's just something that we want to be mindful for. So we're going to do an age-based approach. But I do think once we get into April, it may be anyone that's eligible under the EUA. We may just be able to open it up. We're not there yet, but we may be able to do that.